Social safety net programs in the United States have a number of goals. One is to make sure that we help people in need in some way. Another is to get people back on their feet so that they don't need help anymore. These two goals, however, are somewhat in conflict. After all, if you make it too easy to rely on such programs, people might be incentivized to stay on them indefinitely. This thinking is one of the drivers of what's known as work requirements. In 2015, only 6.3% of all workers and 2.5% of full-time workers were living in poverty. Work seems to be associated, again, logically, with better financial outcomes. But is it really that simple? One of the common complaints about poverty relief programs is that they focus too much on the first goal, alleviating suffering, without thinking about the second, raising self-sufficiency. This is where work requirements come in. In the second of our deep dives into health policy issues, especially those that touch on social determinants of health and health equity, thanks to the support of the Robert Wood Johnson Foundation, we're going to talk about work requirements. First, we'll talk about the basics and other government work promotion efforts. Then we'll discuss what we've learned from TANF, and finally, we'll discuss what this might mean for Medicaid. They're the topic of the next 3 episodes of Healthcare Triage. These days, the news about work requirements is mainly focused on Medicaid. A number of states have pushed for work requirements in these programs or even gotten them approved because policymakers believe that this will be better for recipients. They believe that these requirements will motivate people to go back to work and to get off Medicaid, which will improve life for individuals and save taxpayers money. It's important to understand that there are some reasonable arguments to support this idea. From a cross-sectional and longitudinal perspective, people who work are much less likely to live in poverty than people who don't. The government's 2016 report on income and poverty in the United States showed that in 2015, only 6.3% of workers between the ages of 18 and 64 were in poverty. Only 2.4% of those who worked full-time all year were in poverty. 15.5% of those working part-time were in poverty. Among those who don't work, however, the poverty rate was 32%. Less than 1/4 of adults age 18 to 64 don't work, but these non-workers account for more than 61% of people in that age group in poverty. Clearly, not working is associated with being in poverty. It follows, therefore, that trying to get more people to work might lead to less poverty. Most economists agree that if we make safety net benefits too robust, it disincentivizes work, and some people believe they currently are. Work requirements try to fix this. It's important to note, however, that not all work requirements are the same. They can differ in who's subject to them, the penalty benefit loss process and the ability to be reinstated, and the availability of job search and training supports. Not all work requirements require you to work. Someone who can document that they are actively looking for a job but can't find one can usually satisfy the rules of work requirements. Sometimes programs will even allow job training to meet the work requirement and allow people to qualify for benefits. The goal, after all, is to help people get back into the workforce, and gaining additional skills can help with that. Work requirements, then, incentivize people to work by taking away access to benefits if they don't work or don't actively seek work. There are arguments against work requirements, too. It's sometimes very, very hard to find work, even when you want it. And it can be very hard to find affordable childcare at the times and locations you need to match your work schedule. Sometimes you can find work that's part-time or seasonal, but not work that consistently meets the work requirement. Sometimes the longer you're unemployed, the harder it is to find work in general. Sometimes a crappy job really is worse financially than the benefits. Sometimes people have health and social conditions that make work difficult. There are things we can do to try to fix that, but too often those things cost money. The government could spend more to help people afford childcare, access transportation, and engage in education and training programs that would help them access higher paying jobs, but resources are not always available or sufficient for work supports. Many states considering Medicaid work requirements plan to leverage workforce funds available through other sources. Before we look further at work requirements, let's examine another way the government tries to encourage people to work: the Earned Income Tax Credit, otherwise known as the EITC. If work requirements are a stick, the EITC is a carrot. The EITC is a cash subsidy paid to people who work. In fact, the more that they earn, the more money they get up to a certain threshold. It's also based on the number of children one has. A hypothetical married worker with 2 children in 2017 could net an additional 40% of income, up to $5,610. But here's the thing, the EITC is set up so that it's always preferable to earn more than you do. You will always have more money in terms of income plus subsidy than you otherwise would if you earned less, but had a higher subsidy. In this way, you're incentivized to work and incentivized to earn more. And if you earn money, so you don't work, you don't get an EITC. Nada. Zip. Other programs might try and help you, and we will discuss some of them, but the EITC is a pure work incentive. You need to work to get it, and the more you work, the better off you'll be. A 2015 paper looked at how increasing the EITC affects employment. The economists found that a $1,000 increase in the EITC is associated with a 7.3% relative increase in employment and a 9.4% relative reduction of households in poverty. It's believed that the EITC, coupled with the child tax credit, provided subsidies to families, lifted more than 9 million people out of poverty in 2015. The EITC alone likely lifted about 6.5 million people out of poverty. It's arguably the single most effective poverty-reducing program in the United States. It does this by giving cash to people who don't earn enough, not services or food or medicine, cold hard cash. But it's tied to work in such a way that you're better off going to work than not. You'll almost always be better off. There's even some evidence that the EITC has been associated with improved health, including reductions in low birth rates and increased longevity and quality of life. The EITC enjoys pretty widespread support across the political spectrum in the United States. It gives cash to poor people to supplement their income. It's also a massive work incentive. In fact, raising the EITC is often a more conservative answer to raising the minimum wage. So it's not like work incentives don't work or that they don't have a place in our policies. The EITC, though, is special. It's a carrot, not a stick. The straight-up tax incentives of the EITC also differ in other ways from other programs in which work incentives might be implemented. For example, the EITC is administered by IRS through tax filing and refunds, whereas work requirements are generally done by state agencies where new systems are often needed to track work, exemptions, etc. In order to explain how work requirements in Medicaid might work, we might want to examine how work requirements have worked in other programs. One such program is TANF, and it's the topic of next week's Healthcare Triage.